Throughout the entire United States, only 3 states legalize physician-assisted suicides. I believe that it should be legal throughout all 50 states. There are 3 reasons that the United States should legalize physician-assisted suicides. The first is a lesser cost. The second is the fact that people have the right to have treatment or refuse treatment. And the last is the patient suffering with the illness they currently have. The first reason that it should be legalized is because of patients' rights to have treatment or refuse treatment. On the website connectusfund.org, in the Bill of Rights of Patients is the person's right for their illness to be treated or to refuse the treatment. Now, my first visual aid is of the patient's Bill of Rights. As you can see, there are 1, 2, 3, 4, 5, 6, 7, and it is on number 2, which is called choice. You have the right to choose your healthcare providers who can give you high-quality healthcare when you need it. This means that everyone has a choice on whether or not they feel that treatment is the best or better option for them. The right to refuse treatment was built on privacy, equal protection under the law, and due process. People have the right to know and choose what they want done to their body. Another point is that the cost of an assisted suicide is much less than the illness-related treatment that the patient would be receiving. This makes complete sense. Usually, it takes months, maybe even years of treatment before some people are fully recovered. But with these specific people that know this illness will eventually kill them no matter how much treatment they receive, it could be just a waste of several thousands of dollars. According to euthanasia.procon.org, assisted suicide costs around $35 to $45, while treatment for an illness costs much more. While reading the article, How the Cost of Treating Different Disease is Dividing Spending Growth, the range of costs for treatment in 2012 was ranged from $67 up to $247. Those were the prices 4 years ago. Imagine what it would be like now. The deadliest fatal illness in the U.S. today is coronary artery disease. Now, on my second visual aid, you can see that 7.4 million people died from coronary artery disease in 2012, which is 13.2% of all deaths. Also, 380,000 deaths in the U.S. each year are from coronary artery disease. Evidence from the article, Direct Medical Costs of Coronary Artery Disease in the United States. The annual incidence of this disease is estimated to about 616,900 cases, with the first year of treatments adding up to about $5.54 billion. This means treatment for one person could cost up to an estimated $9,000. The last visual aid that I will be showing you is another disease that costs much money, which is Alzheimer's. As you can see, it has been growing since 2010, and the predicted amount of money in 2050 will be $12 billion. Now, the last main point that I will tell you is that a patient should not have to go through all the suffering and pain that they would go through if they died a slow and painful death rather than a peaceful and quick way. Usually, when going through treatment for any fatal disease, it can be very painful and exhausting for the person with the disease. According to the article, The Right to Assisted Suicide, there was evidence that drugs and pain medicine do not always suffice when trying to take away the pain from a terminally ill patient. These types of patients should have the right to end their lives when they are constantly in pain and suffering from an illness that cannot be cured. Friends and family that have to go through the agony and torture of watching a loved one slowly deteriorate and fade away are also suffering. No one should have to go through such hurting to try to stay alive. If the patient chooses to have a physician-assisted suicide, the friends and family should support the patient and their choice. They no longer want to suffer and go through the pain when they know that sooner or later they will die. The definition of a physician-assisted suicide from medicine.net is the voluntary termination of one's own life by administration of a lethal substance with the direct or indirect assistance of a physician. This should be legal because of the lesser costs, the patient's right to have treatment or refuse treatment, and the patient's suffering and pain with the terminal illness that they have. If the government were to legalize physician-assisted suicides, then people may have a little less hard of a time watching a loved one to pass away in a peaceful way rather than watching them go through the heartache and pain that will eventually occur. My name is Sarah Adams, and thank you for watching this.